oxygen delivery to the heart, medically referred to as myocardial ischemia, is a condition that develops when the heart muscle does not receive enough oxygen-rich blood to meet its demands. And while this may sound like a sudden or dramatic event, in many cases it actually begins subtly, presenting with warning signs that are often overlooked or misunderstood, especially in individuals who assume that heart-related symptoms must always be severe or sudden. But the reality is that the body often provides early signals that something is not right, and recognizing these signs can make a critical difference in preventing serious complications such as a heart attack, because when the coronary arteries are narrowed or partially blocked, whether due to plaque buildup, spasm, or other factors, the oxygen supply to the heart becomes limited, particularly during times when the heart needs more oxygen, such as during physical activity, emotional stress, or even after meals. And one of the most common and important signs of reduced oxygen delivery to the heart is chest discomfort, which may not always present as sharp pain but rather as a sensation of pressure, heaviness, tightness, or burning in the chest, often described as a weight sitting on the chest. And this discomfort may sometimes radiate to the arm, neck, jaw, or back, and it may come and go depending on activity levels, which is why many people dismiss it as acidity or muscle strain. But any recurrent or activity-related chest discomfort should always be evaluated carefully. Another significant sign is shortness of breath, which occurs because when the heart is not receiving adequate oxygen, its ability to pump efficiently may be affected, leading to a sensation of breathlessness even during mild exertion or routine activities. And in some cases, patients may notice that they are unable to perform tasks that were previously easy without feeling unusually winded. And this change in exercise tolerance is an important clue that should not be ignored. Fatigue is another subtle yet powerful indicator, because when the heart is struggling to receive enough oxygen, the overall circulation of oxygenated blood to the body can be compromised, leading to a persistent feeling of tiredness or lack of energy that does not improve with rest. And this type of fatigue is often disproportionate to activity levels and may be more noticeable in individuals who are otherwise active. In addition to these symptoms, some patients may experience dizziness or lightheadedness, particularly during exertion, which can occur when the heart is unable to maintain adequate blood flow to the brain due to compromised function. And this may be accompanied by a sense of instability or near fainting. And while dizziness can have many causes, when it occurs in combination with other cardiac symptoms, it becomes particularly important to investigate further. Another key warning sign that is often underestimated is unexplained sweating, especially cold or clammy sweating that occurs without obvious physical exertion or high environmental temperature, because this can be a response of the body's stress system when the heart is under strain, and it may be associated with other symptoms such as chest discomfort or nausea. And speaking of nausea, some individuals, particularly women and older adults, may present with atypical symptoms such as indigestion, nausea, or a general sense of unease rather than classic chest pain, which makes awareness even more important because these presentations can easily be misinterpreted. It is also important to understand that these symptoms may not always occur together, and their intensity can vary from person to person. But the pattern of occurrence, especially if symptoms are triggered by exertion and relieved by rest, is a hallmark feature of reduced oxygen supply to the heart, and this pattern is often seen in conditions like stable angina, whereas symptoms that occur suddenly at rest or worsen rapidly may indicate a more serious condition such as unstable angina or an impending heart attack. And this distinction highlights the importance of not only recognizing symptoms but also understanding their context and progression. Furthermore, individuals with certain risk factors such as diabetes may experience what is known as silent ischemia, where typical chest pain is absent, and symptoms may be limited to fatigue or breathlessness, making regular checkups and vigilance even more crucial in these populations. Beyond recognizing symptoms, it is equally important to understand the underlying contributors to reduced oxygen delivery, including atherosclerosis, high blood pressure, smoking, high cholesterol levels, sedentary lifestyle, and poor dietary habits, all of which can impair blood flow to the heart over time. And addressing these risk factors through lifestyle modification, medical management, and regular monitoring is a key component of prevention and long-term heart health. Simple steps such as maintaining a balanced diet rich in fruits, vegetables, whole grains and healthy fats, engaging in regular physical activity as advised by a healthcare professional, managing stress effectively, ensuring adequate sleep, and adhering to prescribed medications can significantly improve cardiovascular function and reduce the likelihood of ischemic episodes. It is also essential for patients to listen to their bodies and not ignore recurring or unusual symptoms, because early evaluation through appropriate investigations such as ECG, stress testing, or imaging studies can help identify underlying issues before they progress to more serious conditions, and timely intervention can include medications to improve blood flow, procedures to open blocked arteries, or lifestyle interventions tailored to individual needs. And equally important is patient education, because when individuals understand what their symptoms mean and how to respond to them, they are more likely to seek help promptly and adhere to recommended treatments. Family members and caregivers also play a vital role in recognizing warning signs and encouraging timely medical attention, especially in high-risk individuals, and over time with proper management and awareness, many patients can achieve good control of their symptoms and maintain an active and fulfilling life. But this begins with awareness, and awareness begins with understanding that the heart does not always announce problems dramatically. Sometimes it signals quietly through subtle changes that, if recognized early, can prevent major events. And that is why knowing these 5 key signs of low oxygen delivery to the heart is not just educational but potentially life-saving, because in cardiology time is muscle, and early recognition followed by timely action can make all the difference between recovery and irreversible damage. And as we conclude, remember that your heart is constantly working for you, and paying attention to its signals is one of the most important steps you can take toward protecting your health and ensuring long-term well-being.